If your cat is coughing, it's important to determine the underlying cause in order to provide appropriate treatment. Coughing in cats can be caused by a variety of factors, including respiratory infections, allergies, heart disease, and asthma. To diagnose the cause of your cat's cough, your veterinarian may perform a physical exam, blood work, X-rays, or other diagnostic tests. Treatment for a coughing cat will depend on the underlying cause and may include antibiotics, antihistamines, bronchodilators, or other medications. In some cases, lifestyle changes such as reducing exposure to allergens or quitting smoking may also be recommended. If your cat's cough is severe or persistent, it's important to seek veterinary care as soon as possible to prevent complications and ensure the best possible outcome. Respiratory infections can be caused by a variety of viruses or bacteria and can affect a cat's upper or lower respiratory tract. Allergies are a common cause of coughing in cats and can be triggered by environmental factors such as dust, pollen, or mold. Heart disease can cause coughing in cats due to fluid buildup in the lungs, which puts pressure on the respiratory system. Asthma is a chronic respiratory condition that can cause coughing, wheezing, and difficulty breathing in cats. It's important to never give your cat any medication without first consulting with your veterinarian, as some medications can be harmful or even deadly to cats. In addition to medical treatment, you can also help your cat by providing a clean and dust-free environment, avoiding exposure to cigarette smoke, and maintaining a healthy diet and exercise routine. Regular veterinary checkups can help detect any underlying health conditions before they become more serious and ensure your cat stays healthy and happy.